Hi, this is Eddie Lugo with the Overton Clinic, and today I want to talk about how we can help prospective mothers, expecting mothers, and the mother and the baby after the baby is born. Mothers or women that want to become mothers sometimes might have trouble conceiving, and sometimes that's the mom's body that's the issue, sometimes it's the father's body that's the issue. In either case, we can help, especially when it comes to the mother's body in particular. So the hormones of a mom's body have to be functioning properly, and a big part of that is actually your pituitary gland. Right between your eyes, inside your cranium, is this pituitary gland, and that's called the master gland because it controls most of the other glands of your body and much of the hormones of your body. Well, that has connective tissue that wraps around your brain called the meninges, and that connective tissue turns into this tube where your cord is, and that's called the dura mater. So, long story short, something that's happening with your hips is going to affect your head. And if something serious is happening with the hips, it actually can pull down on the brain, pull down on that pituitary gland. So a mom's hormones might not be quite right if there's some issue with the back or the hips or the neck or the cranium. So we do that kind of work. First of all, we do the assessment to find out what the problem is, but we do cranial work, cervical work, as well as the rest of the body work to make sure there's less pressure or the proper pressure on the pituitary gland. Another issue with moms trying to become pregnant, prospective mothers, is that if the body can't hold the baby, unfortunately sometimes the mother's body actually spontaneously aborts the baby. And that can be because the hips, for example, are in too high flexion. So if flexion is too high, that means that the pelvis is tipping forward. So if the pelvis is tipping forward, it puts an incredible amount of pressure on the uterus, and the mother might not be able to hold the baby. So sometimes, tragically, what happens is that the mother spontaneously aborts. So if we work on the muscles that can bring that pelvis into alignment, then she's able to actually hold the baby in place, and she can have a much more successful experience in carrying that baby.